Hello, First Lutheran. It's Pastor Stanton with our weekly update. In a moment, you're going to hear from Dr. Paul Molling, a member at First and a member of our COVID advisory panel. One note, all 6 of us on the panel want to invite you, that is all the members of First Lutheran and any friends, if you think that they might appreciate some of the information that we're going to go over. We want to invite everybody to a question and answer session next Tuesday, February 2nd at 7 p.m. via Zoom. I've included the Zoom link in the email that had this post in it. You could ask medical questions. We're going to have 2 doctors there. You could ask church questions. I'll be there. You could ask whatever. It's a question and answer session. So next Tuesday, 7 o'clock. Okay, now here's more detail about where we're at right now from Paul.
My name is Paul Molling, long-term member of First Lutheran along with my family. Pastor Stanton has asked me and other parishioners to help advise on the COVID-19 committee so that one day we all can be back together and be safe. Today, I'd like to create a sense of hope, optimism, and confidence. This quote was taken from Ed Bastian, CEO of Delta Airlines. We have been very fortunate in this community not to see the devastation that many other communities have had. I know many of us have lost loved ones and or known others who have been severely sickened with COVID-19. Hope is here. In the last number of weeks, many of us healthcare workers, emergency response workers, and now patients have begun receiving vaccine. Both hospital organizations here in town, along with surrounding communities, have begun vaccinating many individuals. Efforts have now begun and moved to vaccinating those at highest risk, which the Department of Human Health and Services have allowed us to do. In the number of days going forward, will continue vaccinating, but at this time we have vaccinated about 11,000 members in our direct community. Again, hope is to continue to sustain these efforts going forward. This will rely upon the state being able to secure enough vaccine to continue to distribute to our organizations. As I alluded to, we have begun vaccinating those 65 years and older at both institutions here locally. We will continue to do such efforts as long as the supply remains. I am optimistic that the state and national level will continue funneling these vaccinations to us so that we can continue to sustain these efforts. Many other organizations locally and are also beginning to vaccinate, which only helps matters. This is great news to each one of us, and hopefully one day we'll be close to the 50-60% immunity, 50 to 60% of us receiving the vaccination, which will help us get closer to herd immunity, which then means we can gather once again. I'd like to take the opportunity to overstate once we have received the vaccine, we'll still need to maintain proper hygiene, social distancing, and masking. The studies that were done on the vaccination showed it reduced severity of illness and death, but we do not know about what the transmission will be like. Again, the need to get to herd immunity, which is again 50 to 60% per recommendations today. I have confidence that if we stay vigilant, we'll overcome this pandemic and hopefully in the next number of months be able to congregate once again. Hence, the hope and optimism for each and every one of us. There's light at the end of the tunnel, and we'll overcome this. Thank you.